Hi, great. Thanks, Lydia, and welcome everyone. It's really great to see so many people and that lovely even mix between people who've been before, family and friends and new family and friends. And on this really cold day, let's hope we can create some telepathic body heat. Next slide, please. Welcome to Aging Better. Our aim as a programme is to learn more about reducing social isolation and loneliness in people aged over 50. And we're currently in year 6 of a 7-year programme going until March 2022. So there's hopefully going to be more opportunities for us and we're looking forward to sharing more learning with you at future events. As Lydia said, we're a programme of 14 partnerships throughout England, and they range from Middlesbrough in the north down to the Isle of Wight in the south. Next slide, please. And the fact that our areas have been working and delivering for over 5 years means that partnerships have developed real learning and insight into what does and doesn't work. And this comes from having worked to date with over 134,000 people. And on the screen there, you can see some of our overall programme statistics. So 1 in 2 of whom live alone, 1 in 5 are carers, 1 in 4 are from a BAME community, 1 in 22 are LGBTQ+. Next slide, please. And within Aging Better, we've got about 37 projects representing 10,139 people involved in a social prescribing or a community connector project. And our social prescribing projects make up about 10% of the total number of Aging Better projects. And the total number of people involved is a slightly higher proportion at 28% of Aging Better participants. And that's because of the size of some of those social prescribing projects. And we've got some particular stats relating to people who've been involved in those projects, but who have also gone on to fill in what we call a common measurement framework. It's part of our overall evaluation. And overall, the participant characteristics for projects involving social prescribing largely reflect those of the Aging Better programme overall, but with 2 important exceptions. And the first is that social prescribing projects were attended by a slightly lower proportion of people from BAME backgrounds than Aging Better projects overall. 11% of participants in social prescribing projects were from a BME background, whereas it's 25% for Aging Better participants overall. And the second exception is that social prescribing projects were attended by a slightly higher proportion, perhaps understandably, of participants that have a long-standing illness or disability than for the programme overall. And that's 69% and 59% respectively. Next slide, please. So what are we talking about? Well, a connector helps make connections. And within Aging Better, it's an approach to help identify, reach and connect with socially isolated people, and through a person-centred approach, connect them to activities and support that's right for them in their local area. And people who are the most socially isolated, where social isolation is entrenched and embedded, are going to need some level of one-to-one support to help address their social isolation. That transition just isn't going to happen overnight. And the focus of a connector role is of helping someone to identify and then achieve a personalised set of goals for them. And the connector approach of providing holistic, person-centred support built on a relationship of trust is proving absolutely vital within Aging Better. Next slide, please. Now, social prescribing in particular is a model of connector work. It's got particular resonance within the health sector as an approach whereby a health professional can make a referral or prescribe a person to a connector. Social prescribing connector schemes employ individuals, often called link workers, who take referrals from local agencies, including GPs, and work with people to produce a tailored plan to meet their wellbeing needs. And they help people overcome social isolation and feelings of loneliness through involvement in a range of activities, from arts participation, befriending and sport or exercise, as well as debt, housing or employment advice. Next slide. So during COVID, as I just said, the connector role has emerged as being really fundamental role for all of our Aging Better learning to date. But during COVID, everyone's awareness of social isolation and loneliness has increased. And we've heard how some of the stigma attached to loneliness and social isolation has lessened as a result, meaning that more people have been willing to reach out and connect to services. But COVID has also made the functioning of the connector role more challenging for three reasons. One, it's changed the ecosystem that people experiencing social isolation and loneliness can be connected into. And by that, we mean that the interventions, activities, and places that people would have been connecting with are either not there or not as accessible as they were prior to the pandemic. Second reason is influencing the outcomes that people can achieve. So the exit routes for people into new hobbies and new social connections are either missing or not all currently active. And then finally, it's changed how connection can actually happen. Not all connections can now take place face to face. And in addition, the scope of the connector role has also further developed during the pandemic, so adding to its importance and shown that the role can flex. And we identified two areas of operation where the connector role has emerged as new or with an increased level of importance. And that one is the digital connector, giving people the opportunity and support to increase their access to technology and online services. And the other is a shielding connector. So Aging Better area is very aware of the number of people who were still effectively in lockdown and for whom the world had moved on without, and this is when restrictions were lifted last year at points, but for whom they were extremely nervous and unsure about the rules and anxious about going shopping and even visiting local parks. And so areas looked at a range of ways of helping people to connect back into their local environment. And they included buddying with someone to go to the shops or visiting a local park. And we're really pleased that the presenters from our areas now are going to explore with you more about this really hugely important connector role and how it's worked in their area to help people feel connected. Thank you.